Cancer, a terrifying disease capable of endless amounts of struggle. Cancer is defined as unregulated cell proliferation, or cells which grow uncontrollably without regard for the surrounding tissues. Cancer cells will aggregate into large clumps of abnormal tissue known as tumors. These tumors will continue to grow and acquire additional vascular networks through a process known as angiogenesis. Cancerous cells will eventually dislodge from their primary location site and move to a secondary site through a process known as metastasis, a diagnosis which greatly complicates the treatment options available. Current treatment options include radiation, surgery, and chemotherapy. Because cancer cells divide so rapidly, synthetic chemotherapeutics are often specifically engineered to target the body's rapidly dividing cells. However, they exhibit both cytotoxic and genotoxic effects. That is, they will target all of the body's rapidly dividing cells, regardless of whether or not they are cancerous. This often produces many of the unpleasant symptoms that are associated with treatment, such as hair loss, nausea, vomiting, fatigue, and bone marrow suppression. Natural health compounds can help to provide an alternative treatment option which can potentially remove some of the side effects from treatment. My research conducted involves evaluating the efficacy and effectiveness of anti-cancer natural health compounds on lymphoma and leukemia cell lines. Previous research conducted from Dr. Pandy's lab will be expanded upon, specifically in regards to the compounds pancreatistatin, or PST, and curcumin, two compounds which have shown promise in the induction of intracellular apoptotic mechanisms, or assisted cellular suicide mechanisms, processes which facilitate the removal of corrupted cancerous cells. Although the exact mechanism of apoptosis continues to remain unclear, it has been proven that healthy cells have a stronger innate resistance to the presence of these natural health compounds than their cancerous counterparts. That is, healthy cells have a seemingly higher and stronger innate resistance to the presence of these compounds than cancer cells do. In order to determine the optimal threshold in which healthy cells will remain resistive to the presence of these compounds, yet cancerous cells will be destroyed, involves rigorous testing of healthy cells in vitro. Healthy cells are extracted from donors who volunteer their blood, which is then centrifuged or spun at a high speed in order to extract a specific cell. Peripheral mononucleated blood cells are then taken, plated, and treated with various concentrations of these compounds in order to observe for cytotoxic effects at various time points. Cytotoxicity of these cells leads to a reduction in the immune system, as these cells consist of natural killer cells, B cells, and T cells, cells which are responsible for mediating much of the immunity of the body, specifically the cell-mediated immunity and the humoral immunities, immunities which combat active infection while preventing future infection. A reduction in the healthy number of lymphocytes available to ward off infection leads to a susceptibility of the host to an opportunistic pathogen. An infection throughout the duration of treatment is a very disconcerting problem. A reduction in the number of healthy lymphocytes is a very disconcerting problem for someone engaging in chemotherapy treatment, as an opportunistic infection can greatly increase the mortality and morbidity associated with cancer treatment. Ongoing research of these natural health compounds can help to elucidate the most effective concentration and dosage, which can effectively destroy cancerous cells while leaving the healthy cells completely unaffected.